Centers for Medicare and Medicaid Services have approved their first Section 1135 waiver. This first one comes out of the state of Florida. Now, back on March 13th, President Trump declared the coronavirus a national emergency, invoking the Stafford Act for disaster relief. Now, the designation of a national emergency plus a public health emergency means that states can request Section 1135 waivers. This is out of the Social Security Act, Section 1135, that allow them some flexibility in their state Medicaid and Medicare programs. Now, Florida has taken advantage of that very quickly, requesting a waiver from CMS, the Centers for Medicare and Medicaid Services, and those feds very quickly approved that waiver. The response came from CMS on March 16th. Now, this, like we said, was the first response from any state, and we can expect that more states will be writing to CMS in the days ahead. Now, here's what's included in Florida's waiver, and other states are paying attention because they might want to request similar flexibility. Florida has asked for streamlined provider enrollment procedures, reimbursing out-of-state providers with less paperwork than what happens right now. They asked to waive some prior authorization requirements or some permission to get reimbursement for services. A lot of those have been loosened. They've asked to allow care be provided in alternative settings than what Medicaid and Medicare traditionally require. They've also asked to suspend some nursing home screening requirements to provide necessary administrative relief and to extend the deadline for appeals and state fair hearing request. So that's what was largely included in the state of Florida. Other states have been paying attention, like we said, and they may be submitting their waivers soon. We do link to some items in the description below, so you can read up on Section 1135 waivers. You can read Florida's approval letter coming out of CMS. You can see the site where state letters will be posted should they be requested and approved. And finally, we give you a little bit more detail from the Medicaid website on Section 1135 and disaster relief. Generally, that is the disaster relief toolkit that states can follow.